Well, Gaza's healthcare system is on the brink of collapse as hospitals and medical facilities continue to come under Israeli fire. In the north, the Indonesian Kamal Adwan, Al-Shifa, Al-Ali and Al-Auda hospitals have been repeatedly targeted. In central and southern Gaza, Al-Aqsa Hospital, the Nasser Medical Complex and the European Gaza Hospital in Khan Yunis have also been hit. The World Health Organization says 686 attacks have been carried out on healthcare facilities since the war started. More than 90% of hospitals in the Strip have been damaged or destroyed. Targeting medical facilities, staff and patients violates the 1949 Geneva Convention. It's considered a war crime under international law. Manera is an emergency coordinator for Doctors Without Borders, and she's joining me now from Deir el-Balah in Gaza. Thank you very much indeed for being with us. I understand that this is your first mission to Gaza, but you have worked in several different areas around the world where there are humanitarian crises. Can you give us a description of how what you're seeing in Gaza compares to what you have seen in other areas?
Yes, what I'm seeing in Gaza is like nothing I've ever seen before. It's absolutely horrific, the conditions people are living in and the way that they're being forced to run for their lives repeatedly. Not just the population, but our staff are affected every day by this, and they're not safe to work in the hospitals. They're not safe to be going out and doing the water activities, providing safe water to the population every day. The space we're working in is decreasing and our staff are being injured and are at risk of being killed.
With the Israel's blockade on Gaza and the restriction of food and fuel and medicine and getting in, one of the stories, of course, that we've been reporting over the last several weeks has been the increasing amount of malnutrition and starvation that people are facing there. Can you just talk to us about the kind of conditions that your teams are telling you about when it comes to the kind of hunger and issues that people are facing?
Yes, there's been no food let in, no fuel and no medical supplies since the 2nd of March. And we can see that this is having a huge effect, especially on the women and children that are coming into our clinics and hospitals. I see women and children that look like they haven't eaten for weeks. And we know that their suffering is increasing because they can't find a safe place to sleep at night. And the hospital facilities that are open and providing care are becoming less and less because they're being targeted. Just like the hospital we support in Nasser, it's been targeted 3 times in the last few months, and we've had to close down a lot of our services to try and keep operating with what we can, but to also keep people safe as well. It's becoming impossible.
There is a suggestion by the Netanyahu coalition that they are allowing some aid, basic levels of aid in at this stage. Are your teams getting any indication that the aid that is being allowed in by the Netanyahu coalition? I understand about 9 trucks had been allowed in. Apparently, the UN is now saying it has permission for 100 more. Are you getting any impression that that aid is getting to the people who need it?
This aid that's coming in has not been seen by any of our teams on the ground, and 9 trucks is nothing compared to the need here. Even if there are those trucks coming in, we need access to our own aid to come in, and we need to be able to use this impartially for the population. We can't have it used as a tool of the military objectives, and we can't have it used just on the contingency that people are forced into areas where they're not safe, and they're forced into areas, then their homes are destroyed behind them. We need full access to this aid and to be able to provide that impartially to the population. They've been suffering enough now, and it's become a political game.
Manera is an emergency coordinator for Doctors Without Borders. Thank you very much indeed for giving us your time, ma'am. Thank you.
You're welcome.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.